Hodgkin lymphoma is a really unusual lymphoma. It's clearly set apart from the non-Hodgkin lymphomas for several reasons. First of all, it's commonest in the young adult age group, but it does occur at all ages. So you also see groups of cases in elderly adults, and there's a small group of cases in early childhood. So we have these three different age groups where we see peaks in the incidence of the disease. So that's pretty unusual for a lymphoma. We also know that the pathology of Hodgkin lymphoma is very different from the other lymphomas. So when you look down the microscope, the tumour cells in Hodgkin lymphoma are very infrequent, and most of the tumour is actually made up of what we call reactive cells. So these are inflammatory cells that are interacting with the tumour cells, and that interaction between the tumour cells and these other cells is very important. And the third interesting thing about Hodgkin lymphoma is that we know that a virus, the Epstein-Barr virus, is causatively involved in some cases. So about a third of cases in industrialized countries are associated with the Epstein-Barr virus. Now, Epstein-Barr virus, or EBV, is actually a very common virus. So most of us are infected by it, and we carry the virus for life. And the virus actually is the causative agent of glandular fever or infectious mononucleosis. But in a small number of individuals, this virus also causes Hodgkin lymphoma. And so, of course, we're very interested to know why some of these, some individuals get an EBV-associated form of the disease. So the disease clearly has a lot of heterogeneity. There are different things going on in different age groups. There are different things going on in EBV positive and EBV negative cases. But despite this, the clinical presentation of the disease is very similar in all the, whether you're EBV positive or negative and what age you are, and the treatments are generally the same. The interest of our group, and particularly of this Hodgkin lymphoma working group, is looking at risk factors for EBV negative young adult cases. This is a really interesting group of cases, and we really know very little about why they get the disease and why this disease is more common in young adults. And there's been a lot of epidemiology performed on these cases over the last decades. And one factor that emerges is that people that are more likely to get this disease are generally people that have experienced fewer childhood infections. So we think there's a sort of an association between, there is an association between some degree of social isolation in early childhood, fewer childhood infections, a better standard of living, and development of this disease. At the moment, clinically, there's a great interest in trying to identify at the time of diagnosis the patients that are going to do very well and the patients that are going to do less well. For those that are going to do less well, we want to treat more aggressively at the start and decrease their chance of relapsing. And then for the people that are going to do well, we actually want to identify them so that they can potentially be given less treatment and therefore suffer fewer late-term effects. And actually there's a lot of interest in our group here at InterLymph in looking at biomarkers. And the biomarker studies tend to fall into two groups. So on the one hand, there are studies that are being pioneered by our colleagues in Vancouver that are looking at panels of molecular markers in the actual tumour biopsies, and they're using the expression levels of these markers to predict who's going to do well and who's going to do less well. And these prognostic or predictive markers are looking very promising. There are others of us who are working on much simpler biomarkers, markers that can be detected in blood samples. And one of these is particularly interesting. It's a marker called TARC, or CCL17, and it's produced by the tumour cells in Hodgkin lymphoma. It's highly expressed by the tumour cells, and because of this, the marker is also detectable in blood samples, in serum and plasma samples. And you get very high levels at the time of diagnosis in Hodgkin lymphoma patients. And then following treatment, the levels go down very quickly. And this marker, TARC or CCL17, appears to be an excellent marker of disease activity. So it's not being used to predict outcome, but rather to measure disease activity and therefore to measure treatment response. So in the same way as PET scanning is used to measure treatment response after 2 cycles of chemotherapy, CCL17 appears to be able to be used in a similar way. So you see the levels in blood fall dramatically after treatment started when people are responding. So we hope that this might be able to be used as an adjunct to PET-CT scanning to look at treatment response, and also in resource-poor countries this could probably be used to monitor treatment response. It's also potentially useful for early detection of relapse. If you're monitoring patients in follow-up using this marker, and if you see it going up, this might be an indication to look at the patient more closely and see whether there is any indication of relapse. And our group are actually using this marker to see if we can use it to help the early diagnosis of Hodgkin lymphoma.